Joining us tonight. My name is Rob Seworth. I'm one of the assistant directors in the admissions office. I work with students from Illinois, Wisconsin, and then the majority of Asia, but I will not be presenting tonight. And so I'm going to turn it over to Karen, who will take it away. I'm going to turn my camera off, but I will be in the background. And so if any questions come in while she is talking, I might answer them if they have to do with admissions, or I will leave them for her if they have to do with her field of interest. And thank you.
Welcome. So my name is Karen Szynski. I'm the nursing director here at the Health and Wellness Center on the Lehigh University campus. I've been a nurse on campus for going on 30 years now. So, while COVID has been challenging, I've been through many changes here on the campus, and I'm excited to introduce you to some of the services that we provide and what you can expect when you're here on campus. We are currently located in Johnson Hall. We have a satellite office in our Tremblay Park area. So because of COVID, we have kind of adjusted midstream to kind of meet the needs of students, in order to mitigate risk. We are seeing well students in one area and those students with COVID symptoms in another area. Our services have changed quite a bit since COVID, but we're hoping that the fall semester is going to bring us back to some sort of normalcy. So the Health and Wellness Center on campus is staffed with physicians, it's staffed with nurse practitioners, it is staffed with nurses, and of course our front administrative staff. We are generally available on campus live Monday through Friday, 8 a.m. to 5 p.m. We do always have a provider on call 24/7. That provider can be reached by phone. We generally do not come in after hours, but again, always reachable on phone for any questions or things that cannot wait till the morning. We kind of describe ourselves as we're kind of your primary care providers, for the 4 to 5 to 6 years that you might be on campus. But also kind of that urgent care. So we kind of we're kind of a hybrid, if you will. Previously, yes, we had appointments online. Previously, you could walk in for any type of urgent visits. Right now, we are strictly appointment only. We do screen all of our appointments and talk to students on the phone first before bringing them in for appointments. Most students that call, will have a return phone call that same day, generally an appointment that same day. We provide services that include, obviously, any type of exam testing revolving around COVID. We do well woman visits, we do injury visits, we provide certain immunizations. We have a lab that comes 3 times a week to provide lab work and blood draws, either for tests that our providers have ordered or possibly orders that you bring from your primary care providers in other states or other hometowns. We stock most medications in-house. So we have a variety of, whether it be over-the-counters or prescription antibiotics that we dispense directly from the health center. So we kind of look at ourselves as a one-stop shop. You might, have a telehealth with a nurse first, then be brought in for an exam with a physician or nurse practitioner. During that exam, whether you need COVID testing, whether you need rapid strep testing, whether you need an injury looked at or a wound cleaned up, that will all happen in-house. If you need medications based on any of those exams or visits, we can dispense them directly from the Health and Wellness Center. To be seen at the Health and Wellness Center, all that's needed is your university ID. So any registered student has access to our services. Yes, we encourage you or require you to have insurance, but that is based on services that we can't provide. That would be if we have to refer you out for testing, refer you out for an x-ray. So again, to see our healthcare providers or to make an appointment at the health center, it is just that you're a registered student. Our doors are, while they're closed, they are open to all students and access for all registered students. What else can I say there? I talked about appointments, insurance. I talked about medications that are available. I'm hoping that the fall is going to bring a new look to Johnson Hall. We have done some things this past year. We renovated one of our old dorms to again separate the well from the sick. But this summer we will be renovating a floor within Johnson Hall so that our health centers can come back together. So we are hoping to be on the second and third floor of Johnson Hall. We are hoping that we will be able to open our doors more openly, and accept students in, possibly in that more urgent walk-in need. But again, we do generally see all students that call ahead of time. Question, yes, this is the question and answers. You can always put them in the chat. I'm not sure where I'm at as far as services for this direct population and questions that you may have. We have, I mentioned the physicians, the nurses, the whatnot. We are trying to do outreach. We generally will have clinics set up. We're looking at bringing in clinics for COVID vaccine. We're looking at bringing in clinics for the flu vaccine. These are all services that we do. Flu vaccines is something we do in a normal year. COVID vaccines is something we're aggressively looking at to bring in for the new year. The best way to learn about our services and our staff is to check out our homepage. And I'm going to pull that up now. So again, when you're on the Lehigh's homepage, if you go to health services, that's going to bring you to the Health and Wellness Center homepage. This is the best place for you to find out what is going on in the health center, what is going on campus. And it is also the direct connection to the patient portal. We have worked aggressively, even during pandemic, to switch over to a completely electronic health record system. This system now allows students to have complete access or total access to their records at all times. We use this to gather your immunization information, forms, your visits, and as of now, or as of next week, you'll be able to access account summaries and visit summaries of all your visits at the Health and Wellness Center. So this access to the patient portal becomes available, I believe, once you're registered. Forms that we're going to be sending out will become available probably after May 1st. I can give you a peek at this by signing in as a test patient. So again, this would be your same Lehigh user ID. We're found on the Health and Wellness Center homepage. You're going to log into the patient portal here. You would log in your Lehigh ID at, you may have to register initially. And as soon as you are a registered student on campus and have access to this, I highly encourage you to do so. Again, we are trying to go completely electronic, so no paper forms. It's better for us, it's better for you. So when we look at your patient portal, it may look similar to if you've done anything else in other hospitals or other healthcare systems. So again, in our portal, across the top is going to be your immunization compliance, something that will become important as you're arriving here at Lehigh. We have in these screens, the home, the My Profile. These features here, the images, the My Chart, these have just become active in the last week, and they will become more important in the weeks moving forward. Because in the My Chart, and again, this is a test patient, no real information here, you'll be able to look at your chart notes, your account summaries, and this is the lab orders and the lab results and forms. These are, again, I would say the lab results is what probably interests most students when we are running, whether it be the COVID test, whether it be a strep test, whether it be blood work. You'll have immediate access to your lab results. We are interfaced with the local labs, so even if we are not up and looking at the labs will come over to your patient portal live. The forms section, this is what's going to become important probably after May 1st, where some of these required forms, the tuberculosis screening questionnaire, the acknowledgement and consent for treatment, the health history form, these are all forms, and the immunization history, these are all forms that you can complete online. There are additional forms that need to be filled out and completed by your physicians, but this is a good start to what's available online, and again, should be available to all new students starting May 1st. This is also the area where you can send secure messages to our providers, to our nurses. This is, again, different from email because it's more secure. The rest of the campus does not have access to this. It's, again, a place where you can either view messages or send messages. Again, the forms are going to be in this area, and it's going to explain to you which forms need to be filled out when. Online scheduling is something we've had in the past. We have not had in the past year because of COVID, but we're hoping to bring that back where you'll be actually able to schedule an appointment with a provider right on the computer, whether it be 10 o'clock at night or 10 o'clock in the morning. Viewing appointments is nice because in viewing appointments, again, is where you might find some of your appointments and and if we had mailed you any information is going to come up in this view appointments. Document upload, again, this is where those papers, so there are a few paper forms that we will need, including your physical form and your immunization record. So different from the immunization history form that you enter the dates, the immunization record and the physical form are ones that need to be completed and signed by your primary care physician at home. So again, this is something, once you're registered, will become available. You want to get to know this. It's also where we post any important information. It's where we do the majority of our communication. And as we roll it out, we'll be using it more and more. We jumped into this in January, right in the middle of the pandemic, and are excited to share it with all of our students. So I have a question here. Will the COVID vaccine be required in the fall? So one of the things when we talk about immunization requirements, we do have a fair amount of immunizations that are required. We were one of the first universities to also require the meningitis B vaccine. We are currently discussing this with the upper leadership as whether or not we will be requiring the COVID vaccine. Keep in mind that when we do require a vaccine, even when we first were requiring the meningitis B vaccine, it's to ensure that we educate. Again, a waiver can be signed if you do not choose to take the COVID vaccine. We do know that it is still in the emergency phases, if you will. So while it may become a requirement, and it is strongly encouraged, we saw a lot happening with the COVID on campus as far as isolation, as far as moving people. Currently on campus, if you are vaccinated against COVID, you do not have to quarantine and isolate if you are exposed to a new case. So may the COVID vaccine be required? It's a possibility. I would say it's probably a strong possibility. But again, that's so we can educate. And then those that choose to get it, yes, send their vaccinations in. Those that choose to waive it will have to more than likely be under the understanding that if there is a large outbreak, you will have to leave campus on your own accord versus us relocating you as we've done this past year. Another question, Cam, as an international freshman, will it be allowed to get vaccination records on campus? So yes, we do provide vaccines on campus. Some of the vaccines we provide on campus are definitely the meningitis vaccines, both the regular meningitis that protects against the 4 strains ACYW and the meningitis B vaccine, 2 available for that. We carry both of those. We carry the Gardasil vaccine, which is a vaccine that protects against different strains of HPV. We carry tetanus boosters, both the plain tetanus and the tetanus with pertussis. Currently, we are not administering or stocking the COVID vaccine. We are currently, for current students, actively involved in organizing a clinic with our local health bureau to provide those COVID vaccines. So when we do make a requirement, we do make sure that there is availability for those vaccines, whether it be directly on campus through us, or whether it be on campus or nearby through our local health department. What else can I tell you here about our services? We are, some of the services we had on pause, we are hoping to bring back as early as July 1st, things like study abroad physicals and driver's physicals. We had been doing some well visits, But we're hoping to bring a lot more of those back because, again, a lot of our attention was drawn to treating and examining those students with COVID-like symptoms and isolating and quarantining and testing as soon as possible. We have COVID testing on campus, a couple of different ways that you can get tested for COVID. In the health center, we have a relationship with our local lab. They have a lab tech and a lab machine in our department where we are able to collect specimens and get test results within an hour, hour and a half. These are nasal swab PCR tests. We will also arrange for what we call tent clinics, where we will do testing or swabbing, whether it be outside or in a remote location, for students who are close contacts and do not have symptoms. Those are usually sent to the local lab, and we generally get those anywhere from 24 to 72 hours, again, depending on the rate or the volume in the community at that point in time. Of course, there is a lot of surveillance testing still going on campus currently. What that will look like in the fall, I'm not 100% sure. One thing this pandemic has taught us at the health center and everyone else on campus is that things change almost daily, sometimes even twice daily. The best place to find out this information, again, is to stick to the homepage, whether it be of the Health and Wellness Center or Lehigh's actual homepage, where I don't know if any of you have had the chance to explore their the COVID access. We've got lots of great information, statistics, and data that go on daily. We had pretty big surges in February. We are pleased that the little blip in surges we had recently have kind of leveled off. So again, the COVID site that's on the Lehigh's homepage, the Information Center, is a great resource. We have tried to make sure that all of our departments connect to this one site so that we are giving the same information to all individuals at the same time. But you can sometimes find more specific ones on our website. I'm going to pause a moment to see if there are any more questions about the Health and Wellness Center. We are excited to keep moving forward with the renovations that are going on our second floor at Johnson Hall. We're hoping, again, to bring back a lot of the in-person outreach that we had been doing. Myself, in addition to being a registered nurse and director of nursing, I'm also a registered nutritionist. So we have done nutrition counseling, on campus. We have a variety of physicians with different interests. So again, generally we can meet the needs of just about anything that rolls through our door. We have great relationships with not only our local health department, but other physicians and practices in the area. Most things can be handled at the health center, your simple illnesses, your simple injuries, your wellness visits. But if we do need to refer out, we have a great network of local practitioners that we are in constant communication with as far as their services. A question about, can students request a roommate that has vaccinated? That, again, that's probably going to be more on our leadership level, and where that goes, I am not sure at this point. I will make a note of that, as I know that our medical director and our executive director are very much entrenched in those meetings that go on daily with what we call our CRT or COVID response team. Again, I know today the latest response was that we were allowing more outdoor and indoor gathering in controlled numbers, but that the double face masks and the social distancing was still being encouraged. Where the vaccine is headed and where the requirements and restrictions are headed, I'm not 100% sure, but I know that that is an active discussion on campus. So I will make a note of that question and I will forward it up the chain, if you will. Even with being on campus 30 years, and sometimes I'd like to think I know most of the answers. If I don't, I will make sure I find out where they are. So thank you for asking that question. That's a great question. We've got about 5 to 7 more minutes. Before my time is up, I'm not sure if this talk is sandwiched between other talks, but if there are any other questions, please let me know. Has anyone in this group been vaccinated yet? A question about specialty in substance or misuse issues. We are now, our executive director is coordinator of both the health and wellness center, as well as our counseling department. We work closely with our counseling department as far as, things that require more of that cooperative or cohesive link. I know for myself, I work with the counseling department when we're talking about things of disordered eating that we know, is a multi-approach. I believe as far as substance use and misuse, again, that same type of approach, we're going to work together with the counseling department. And if we do feel it's something that needs more of a specialty approach, we'd make that connection as well. I know a lot of times for first-year students or students new to our campus, transportation is an issue, but we do try to, again, find those areas that are local or bring on campus as needed. When coming to campus, again, in addition to filling out the forms, that's the best way for us to get to know you. So again, keep an eye out for that patient portal, the health history form, the immunization form, the physical exam form. The more information you provide us, the better we are going to be able to take care of you. We, again, most of the services are free of charge. So as I mentioned, the only thing needed to come see the Health and Wellness Center is your student ID, or again, registration as a student. The appointments themselves, no charge. Some of the antibiotics do have a small charge associated with them. I want to say most of our medications are anywhere from $3 to maybe $9. You have the option of us calling in a prescription if you'd prefer, depending on your prescription plan. But most of the antibiotics, over the counters, those are samples at no fee. But some of our antibiotics do have a small fee associated with them. We generally put most of those charges onto your bursar account. But if you would prefer us write a prescription or send it to a pharmacy, we can also do that. When we talk about the blood work in-house, yes, we can order it, we can follow it up, but that will generally go through your insurance. So that's definitely a reason to make sure that we do have your insurance information in your patient record. When you're thinking about insurance and coming to Lehigh, you should be asking your insurance company, if I'm going out of state and if my physician at the university orders a test, will it be covered? This comes into play sometimes with some of the HMOs and some of the out-of-state insurances. So again, ask ahead of time, because the more prepared you are, the better. It's sometimes impossible for me to keep up on all the insurances that students come with. The COVID-19 behavior reporting form is something that comes out of the Dean of Students office. We do not, again, at the health center, we are focused on taking care of the student. So, the behaviors or the academics, we do provide, information about where to get academic support. We do obviously have communication with other departments on campus, but our focus is to take care of the student, to take care of their illness, to test their illness, to foster their recovery, to manage their isolation and quarantine if needed. But as far as the behavior reporting form, that happens in the Dean of Students office. Yes, you do need to have insurance info on file. That does need to be uploaded. I know the bursar's office, not our department, but the bursar's office will require insurance information on file. Otherwise, they will automatically or request that you enroll in the student health insurance. The student health insurance is an option because it is a fairly low cost depending on where you're coming from. With the student health insurance, we know that it will cover anything we order. So depending if you're coming from out of the country or possibly with an insurance that is more of an HMO from another state that won't be covered in Pennsylvania, it's something to consider. because we do know that it will cover anything that can't be covered at the Health and Wellness Center. Most of the time, the insurance information and questions or purchases are done through the bursar's office, but on our homepage, there is a link to the student health insurance and what it covers. While we don't require you to upload it onto our page, there is a place to upload the front and back of your insurance card to the health center page, which of course will make any testing or any services outside our department much easier to manage once you're on campus. The immunizations that we provide on campus do have a fee associated with them. We keep that fee extremely low. It's simply the cost of the vaccine, not the administration. With the student health insurance, it absolutely covers all vaccinations on campus. So if you're talking about the tetanus that might cost about $45, or the Gardasil that costs maybe about $230, I know for sure that the student health insurance covers and reimburses that fee, no problem. My understanding is that most other insurances also would cover required vaccines. Again, once the vaccines are approved by groups like the ACIP or the American College Health Association, almost always insurances are going to cover them. So the ones that we do stock are generally covered by insurance at this point in time. Of course, we know that the COVID vaccine at this point in time is being distributed mostly for free, as far as I'm aware, throughout our state and this country.
All right, so that is just about all the time that we have. There is another session starting in 15 minutes. And so we are sandwiched pretty closely with everything else happening around us. If you all did sign up for it, it is the counseling services session, will be at 7:15. Like this one, it will also be recorded. So if you aren't able to attend or weren't able to sign up for it, it will be online eventually for you to view too, just like this one. Thank you all for joining us for this session. Karen, thank you for taking the time to answer some questions. I'm glad we had some for you to answer. And I will put my email in the chat. I'm not super helpful with any topics related to this, but if you do need anything from my office, the admissions office specifically, or if you would like to be connected with anybody on campus, we can definitely help you with that.
Yep. Thank you for your questions. They were great. We look forward to welcoming you to campus. And yes, I've added my email there as well. Please feel free to email me. I check it pretty routinely, especially nowadays during COVID. And again, welcome and thank you.
Hey, Karen, can you make sure you send that to attendees? That went just to panelists.
Oh, I see that.